It's clear from independent populations in South Africa, Denmark, and the United Kingdom that Omicron is doubling at a rate of about 3 to 4 days. It's also clear that the level of contagion is about 4 to 8 times more contagious than Delta. As a result, we also heard the Chief Medical Officer of Health for Ontario speak today, indicating that this is not the time for mass gatherings and that smaller is better. Therefore, particularly given the fact that members of Parliament are coming from all areas of the country and will be returning to all areas of the country, we're going to be initiating a number of changes. Tomorrow, our caucuses, both the National Caucus, regional caucuses, and sub-regional caucuses will all be meeting virtually. Tomorrow in the House of Commons, we will have a greatly reduced presence in the House of Commons. We will keep a large presence of ministers, but we're going to ensure that physical distancing is in place and that all individuals in the House will be separated from each other by at least 6 feet. And we encourage all Canadians to get vaccinated, get their booster shot, and certainly have their children be vaccinated. I'm happy to take any questions.
So when you talk about the capacity being...
Oh oui, je peux dire en français aussi, je m'excuse. C'est clair aujourd'hui que la situation actuelle est sérieuse. Le variant Omicron, c'est vraiment sérieux. C'est évident dans des autres juridictions comme l'Afrique du Sud, l'Angleterre et des autres, que le niveau d'infection est 4 de 8 fois plus haut que les variants Delta. Et aussi, c'est clair que les personnes qui sont responsables pour la santé publique en Ontario a dit que c'est important de réduire la taille le nombre de personnes dans une réunion et de réduire le nombre de personnes généralement. Et c'est aussi le cas que les députés viennent partout au pays. Et alors, ça c'est la raison pour laquelle on va réduire le nombre de députés en personne demain aux chambres de communes. On va recommencer avec tout notre caucus virtuel, pas en personne, pas de tout. Et ça va commencer demain avec le caucus national et aussi avec des caucus régionaux aussi.
Do you anticipate the 6-week break to be longer now after House wraps up?
I think it's what is clear as we continue the fight against COVID-19 is that nothing is predictable. One of the things that I said when we were pushing for the importance of hybrid provisions is that we have to remain flexible and adapt as the public health circumstance changes. So we will be reviewing where we are from a public health perspective to determine the circumstance we return to in January.
When you talk about capacity in the House of Commons, do you mean specifically Liberals will be reducing their capacity, or is this all parties, and how is that being decided?
I had an opportunity today at the House Leaders meeting to talk with my counterparts both before that meeting and at the meeting to advise them of what measures we are going to be taking to ensure the safety of not only parliamentarians but personnel and all people who are on the parliamentary precinct. We are advising them that is our position, and obviously they're going to have to make a determination as to what their reaction is to the evolving public health circumstance.
How can you ensure that there is physical distancing within the House of Commons chamber if one party, for example, decides that they want to remain in the House? Then there's not going to be enough seats on that side to have empty.
I think on the government side of the House, I can assure that we will have physical distancing present. We're encouraging physical distancing to be taking place everywhere. I think that the advice that we're getting from public health officials is clear, and so I'll leave it to the other parties to decide what's going to be happening on the other side of the House.
Rapid tests as well. I know that Freeland had some today. Some of the Conservatives are getting them almost daily. Is this something that's going to be happening more frequently as well?
Look, with respect to testing, we have to acknowledge that the rapid testing, the antigen testing is not as efficacious as other forms of testing and therefore is unreliable. Given the degree of transmissibility of this particular variant, I think it makes sense that we adopt a much more careful posture, particularly given that people are coming from all over the country to this place and are going to be leaving this place to all over the country.
C'est un lien aujourd'hui, ce que vous annoncez, avec le fait qu'il y a des membres de l'équipe de Mme Freeland qui ont obtenu un résultat positif. Est-ce que les autres membres, les députés, doivent être inquiets de ça aussi?
C'est une bonne question. Maintenant, je n'ai pas l'information s'il y a des autres qui sont impactés. On va surveiller la situation et il va y avoir des autres tests aussi. Et certainement, s'il y a un test positif, on va faire des actions appropriées immédiatement après ça.
Is it possible the House might rise earlier than Friday as scheduled? Do you think you might pull the plug
It
earlier?
has never been more important than it is in this moment to ensure the passage of the COVID measures that we have announced in C2, and similarly with respect to paid sick leave. I would call upon members of the opposition. We have been, very flexible in terms of adopting amendments and changes and working with them and giving appropriate time for all of these measures. But the time for debate is over. The time for action is now. As we're dealing with this impending circumstance with this new variant, we have to make sure that this House does its work and is there to support Canadians. So that's what they expect of us.
There's going to be a large presence of ministers. What are you exactly committing to? Because the opposition was obviously very concerned that ministers would take the hybrid option if given the chance.
Let me be very clear. The actions that we're taking are about one thing: public health. To encourage, hopefully, the facilitation of physical distancing everywhere, and to demonstrate that these measures are being taken in the best interest of public health. We're committing at having a very robust cabinet presence in the House so that members can ask questions to cabinet members, but to be able to do so in a way that is safe and follows public health advice.
How many members do you expect?
Sorry, yes.
How many members do you expect to see on the government side of the House?
Well, I think we're working that out to be precise, but I think that if you can extrapolate a circumstance similar to where we were at other times of greater concern in the pandemic, where we at all times maintained physical distancing once inside the chamber, and that we're going to be reflecting something similar to that in the House. En français, c'est comme presque la même situation anciennement, quand les situations étaient plus graves avec le COVID-19. On va assurer qu'il y a une distance entre tous les députés aux chambres, et la distance sécuritaire est plus grande que 6 pieds.
How will you determine which ministers will be physically present?
It's the objective is to make sure that the questions that are being put forward the House have ministers who are able to respond. I think you will have seen in how we've comported ourselves in question period over the last while that we have been trying to use the hybrid provisions judiciously to make sure that a preponderance of questions can be answered in the House. That'll continue to be my policy.
To be in the House, you have to be fully vaccinated. However, with booster shots, people are very quickly needing 3 in order to be considered sort of more fully vaccinated. At what point will the House start changing the requirement that you'll need to now have your booster in order to be able to enter the chamber?
We're going to have to examine our policies. The reality, this is an evolving situation, and it demands hour to hour to have a response that's appropriate to the public health circumstance we're in. There's the evidence with respect to Omicron is that boosters are necessary for stronger protection, and I would expect that we'll be looking at that as a Board of Internal Economy. We have a meeting that will be coming up Thursday. I suspect there will be conversation on this and other matters as this situation continues to evolve.
Est-ce qu'on doit craindre que ce que vous annoncez aujourd'hui, ça pourrait créer un effet boule de neige, parce qu'il risque d'y avoir d'autres mesures annoncées demain? On sait que le premier ministre va parler aussi au premier ministre des provinces ce soir. Croyez-vous qu'on risque d'avoir davantage de ce genre d'annonces-là dans les prochains jours, prochaines semaines, à l'approche des fêtes aussi?
Écoute, la situation actuelle, c'est vraiment sérieux. Les variantes Omicron, c'est vraiment sérieux. Et on doit prendre l'action immédiatement de s'assurer que le chiffre ne pas augmente d'un niveau qui menace l'hôpital et la santé générale pour les Canadiens. Alors, ça demande de l'action. Ça demande de l'action généralement, mais spécifiquement ici aux Chambres de communes.
Are the Conservatives being cooperative in these talks? Obviously, there were challenges earlier on that you've described. How are they, especially on issues of boosters and such?
I've had an opportunity, and I have to say, Mr. Deltel, who is the Conservative House Leader, both in my time as whip in the previous Parliament and in my time as House Leader here, has been exceptionally cooperative and easy to work with. I expect that that will continue through this and unfortunately other turns and events that will occur as we continue to deal with this global pandemic. I'll take 2 more questions.
Now, given that Dr. Tam was warning of the very serious nature of Omicron and the community transmission on Friday.
I think that, look, we're all very fatigued, but one of the things that we have to do is act when evidence presents itself. And we had to wait to make sure that the evidence was such that these actions are necessary. Canadians are tired. This has been a long, dark period, and I think most of us were hoping that most of this was at our back, and we didn't want to have to face additional restrictions or sacrifices. So it's imperative that we do act when the information is there, but that we do not act prior to that information being confirmed in such a way that would be inappropriate for what we knew at that given time.
Just to refresh my memory, how many MPs did you have in the House at the last bad point in the pandemic?
We look in the previous parliament. Those numbers vacillated depending on the public health circumstances. At the height of the concern, we had very few numbers in the chamber, only 1 or 2 at certain moments in time. The circumstance I'm talking about, when you have everybody at a particular distance, is more in the neighborhood of 25, 30, in that kind of neighborhood. It's hard for me to put a precise number on this because we're obviously in a state where these facts are evolving and where we're having to make these decisions in real time, but it's something in that order of magnitude on our side of the benches. Thank you very much. Sorry, one last one.
Yeah, I was just wondering, thanks, about the Bloc Québécois, because they were the other party that had insisted on a return to full House physically. How do they react to your...
At this point in time, the information has been shared. I haven't received a response back, so I've simply stated our position, and that's where we are at this moment. Thank you so much.